Today I wanted to begin a mini series with you guys that's discussing and understanding our menstrual cycle. This way we can help support the body through each phase and learn what works best for us rather than fighting against it. Okay. So the menstrual cycle ranges between 28 to 32 days. It is different person to person, and then those phases vary between person and person as well. The menstrual phase is our first phase, so that's typically days 1 to 5, but that can vary and can be longer. During this phase, our hormones are low, so estrogen and progesterone, they're lower, which results in lower energy. So we want to focus a lot more on gentle, low intensity movement, so walking, yoga, stretching. This is the time that most females will have lots of chocolate, lie in bed, watch a movie, maybe we're crying. We're just focusing on comfort and relaxation. So an example of a really good stretch that I like to do is just a glute stretch. So you can do this sitting or lying down, but if we're feeling a bit uncomfortable, lying down is definitely preferred. So lying on your back, this could be bed or the floor. We're coming down into a 4-point rest. So ankle onto opposite knee. This honestly might be enough for you to get a stretch through this opposite glute. If not, hands come through and we're holding our knee to our chest. You want to do this 30 seconds to a minute. Honestly, as long as it's comfortable, you can stay there for longer. And then we come in, swap, and you can do the other side as well. Continuing on with our mini series, our second stage is the follicular phase. So this is typically our days 6 to 12. This is when our estrogen's increasing, so our energy's coming back in, we're feeling a bit more motivated, a bit more concentrating, just getting everything back to normal, feeling like everything's resetting again. So this is the time that we do some strength training, maybe you get back into your running, your interval running, any sort of strength work, coordination, maybe it's a new sport, or we're just getting back into the team building. This is the time to really focus in on all of that. Continuing on with our mini-series part 3 of a menstrual cycle. So this is the ovulatory cycle. This is days 13 to 15. This is when we're in our peak estrogen level. So really high intensity, high confidence, lots of power, a lot of strength, higher sex drive. We're really trying to focus on the higher intensity exercises. So your HIIT workouts, heavy lift training, this is your sprinting or high intensity running. Just make sure that you've got a lot of power here, that we're still focusing on your warm-up and your recovery afterwards, so we're not prone to any injuries. So this is part 4 in our mini-series, continuing on with the menstrual cycle. So this is our final stage, the luteal phase. This is days 16 to 28, or could be longer depending on the person's cycle. This is when our progesterone is increasing. So we're slowly starting to feel that decline in energy. We're getting a bit more fatigued. We might be a little bit more grumpy coming into our period. This is when we focus more steady, structured movement. That could be Pilates, more consistent, gentle strength training, basic running as well. And we're just focusing on that consistency rather than pushing our max effort or training really hard. Final takeaway with this series is this is not a right thing or wrong thing to do. This is just a suggestion to help support the body during these phases. It might not work for you, it might. It's just listening to where our hormone levels are and what might work best for you. So give it a go and potentially it'll help you out.